And tomorrow, we're going to do something a little different, something that I'm really looking forward to. Tomorrow at 1 o'clock, I'll have my daily press conference, but it's going to be for children. So I announced last Friday that tomorrow I would be having a press conference just for kids to answer their questions. And I'll be honest, when I announced that, I wasn't really sure what would happen or if any kids would have questions. And we've already received over 12,000 questions. So the kids are ready, the kids are tuned in, and I'm excited to have a chance tomorrow to talk to them and do my best to answer their questions. Today, I'm very sad to say that I have to report another 2 deaths in the state of Rhode Island on account of coronavirus, bringing us to a total of 10 fatalities so far. I'm also announcing we have 77 new cases in Rhode Island, bringing us to a total of 566 cases and 60 people in the hospital. I'm going to go through the rest of my comments, and then I'll be turning it over to Dr. McDonald from the Department of Health. I do want to make a note. Occasionally, I am here with Dr. McDonald instead of Dr. Nicole Alexander Scott. Nicole is fine. She's doing great. I'd like to give her a break once in a while, and she also has different work that she's working on. So rest assured, she's doing great, feeling well, and Dr. McDonald is fantastic. As is the whole team at the Department of Health. I would like to make a special thank you. It's just unbelievable to me how talented the people are at the Department of Health, top to bottom, how hardworking they are. I am so lucky. I spend my time talking to other governors, and we have the A-team here, so thank you all for who you are and all that you're doing. Today's April 1st. And that means that we've been at this for exactly 1 month. It was 1 month ago today that I reported our first case of coronavirus here in the state of Rhode Island. I don't know about you, but for me it feels like it was about a year ago, not a month ago. And I wanted to take a second to pause and reflect on where we've been together as a community over the past month. Although it's been an anxious time, and although every day is long, and I know people are getting more and more anxious, it is astounding to me how much we as a state, the people of Rhode Island, have together accomplished in the past 30 days in mounting this fight and defense against the coronavirus. We were among the very first states, I think probably the first state, to extend unemployment and disability benefits to people out of work. Since that time, Scott Jensen and his unbelievable team at the Department of Labor and Training has responded to nearly 20,000 phone calls and answered over 7,000 emails. They've helped to connect tens of thousands of Rhode Islanders already with financial support. Thank you, Scott, to your team and the heroes at DLT. I want Rhode Islanders to know help is on the way. We are putting more staff on the phone lines and more staff in the process at Department of Labor and Training. We're taking steps out of the process and doing everything we can to more quickly get money into your pockets if you're out of work. Again, I say every day, the most heartbreaking stories I'm hearing now are the stories of small businesses who are closed, those of you worrying, will you ever reopen, those of you who are out of work. I'm hearing you on that. We're trying every day to do things a little bit better to bring you some relief. But I want to say thank you to Commerce Secretary Stephen Pryor and his team. In the last month, we've established the 521 helpline, 521 HELP. That's a one-stop shop for any business concern. More than 1,500 businesses have contacted Commerce. They're getting back to people within a day. Dozens of companies have used the free tech help. I would encourage you, especially if you're a small business and you need a hand to learn how to work remotely or set up a website, or you need technical help, call for that. We're having great success. In the past month, we've deployed 200 local businesses who are either making critical supplies for us or donating critical supplies to us. I want to thank you. There have been over 50 local manufacturers who have offered to retool your operations to start producing critical products like hand sanitizer and masks and gowns. Again, thank you. We've massively ramped up testing. A month ago, I didn't even know what these tests were all about, and now, due to the team we have in place, we have 6 swabbing sites all around the state and 6 labs processing these tests. We're completing more than 500 tests a day, which puts us on par with Massachusetts and ahead of many other states. And I'm very proud to let you know that by tomorrow, we'll be at a capacity of 1,000 tests a day. So I have a special message to our primary care providers. Primary care providers, start sending us folks. By tomorrow, we'll be at our 1,000-person-a-day capacity. We're relying on the primary care providers to screen and triage patients and go ahead and start making appointments for getting patients swabbed, because we're going to be able to have these tests happening. Again, this is unbelievable, because a month ago we were running, essentially no test or a few tests in one lab in the basement of the Department of Health building, and now we're doing 1,000 a day, 6 centers, staffed by the National Guard, and 6 different labs. Thank you to the team who's made that happen. We have been, as I've told you, scouring the world for the critical supplies that are necessary to keep people safe. In the past couple of weeks, we've procured 500,000 respiratory masks, nearly 500,000 surgical masks, and we are ramping that up every single day. We tried something new. We were the first state in the country to say that we were going to allow our kids to continue to go to school, but to do it through distanced learning, and we're making it work. It's not easy, but we're making it work. We have over 140,000 school children in public schools today, right now, receiving their education. It's in 310 schools, and 97% of school leaders are reporting positive feedback. If you're a teacher, if you're a student, if you're a principal, if you're a school resource officer, take a minute and give yourself a pat on the back, because it is phenomenal, and I'm proud of the work you're doing. So how is all this work happening? Every day I come up here, I stand alone with 1 or 2 people behind a podium and tell you, I do my best to explain to you where we are, where we've been, and where we're going. But the truth of it is, I have a whole army of people behind me working around the clock to protect you and to protect the people of Rhode Island. And so I want to take the next couple of minutes just to give you a view into all the work that's happening behind the scenes. You hear, when you read the paper, watch the news, watch the national news, you hear a lot about ventilators, masks, hospital beds, and all that's important. But here in Rhode Island, we have a much more comprehensive response happening. It's not where it needs to be. That's why we get up every day and work harder. But I want to take a minute to give you a peek into what's happening, hoping that you'll have some confidence that we're getting ready for the surge, which will come, and that we're going to be fine. It's going to be hard. There will be a lot of sick people. There will be more fatalities. It'll be really tough. But we have teams in place working now to make sure we're doing everything we can to get us through as safely as we can. So, for example, a few weeks ago I tapped Steve King to run our supply chain for PPE. Steve runs Quonset. He runs the Quonset Business Park. He does a fantastic job. He got a call from me late on a Saturday night. I said, Steve, I'm calling you in off the bench. I need you to assemble a team to do nothing but 24/7 get us, the state of Rhode Island, PPE. And he's doing that. He's doing that in every way possible. Local manufacturers, FEMA, on the phone in the private market. He has a team of people working for him, and all they do all day is purchase for us masks, gloves, gowns, face shields, goggles, N95 respirators, regular surgical masks. Right now, 2 weeks ago, we didn't even have this work stream. Today, right now, we have on the way to Rhode Island over 5 million N95 masks, over 3 million surgical masks, hundreds of thousands of gloves, hundreds of thousands of gowns. We have local manufacturers retooling their systems to produce some of this equipment for us. It's not here yet. Every day's a battle. Sometimes when the order is made, federal government comes in and cancels it. But you should know there's a team on it. They're professional. I check in with them every day, and millions of resources are coming into our state in the coming weeks to keep our healthcare providers and our first responders safe. Testing. As I just announced, by tomorrow, we'll have the capacity in our system to swab 1,000 folks a day and test 1,000 folks a day. Thank you to all of you who made that possible. Soon, in a week or two, a week or so, I'd like to have here in the state of Rhode Island same-day testing widely available. That's where we're going. I don't know exactly when it'll be. That's the goal. We're working it every day. Contact tracing. We have a whole team that does nothing but contact tracing. This is a huge effort. Yesterday, I asked you to do something, and I'm going to ask you again today, because if you haven't done it, I need you to do it today. Contact tracing will save lives. It sounds simple. It's a lifesaver. I need every single Rhode Islander, get a notebook, and at the end of every day, while it's still fresh in your mind, I want you to write down where you've been and exactly who you've been in contact with, and write the date on it. It should be very easy, because you should be saying, I've been in my house and in contact with my family. But for those of you who have to go to work, or maybe you went to the park, or maybe you go for a walk, or maybe you went to the grocery store, I need you to write it down every single day, so that if you do get sick, or someone in your family gets sick, our contact tracing team has a better ability to figure out who you may have spread the disease to. Where we want to go with contact tracing, and what our contact tracing team is doing, is a much more technology-enabled contact tracing method. So right now, we have a team of technology folks, some of whom I brought in from the private sector, some of whom are volunteering, some of whom are in the National Guard, some of whom already worked in the state. All they do all day is work on how to figure out how to do the best, most sophisticated, most accurate, most real-time contact tracing. So again, I hope in a week or two, I'm able to say to you, we can have much more widespread contact tracing, and we can track people based on their symptoms, based on their location, and we can do it in a tech-enabled way. Until then, thank you to the hundreds of people who we have doing this manually. It's very difficult, and they're doing a terrific job. We have a team doing nothing but quarantining. Quarantine is also the key. As I've said so many times, I cannot and will not let this economy be closed one more day longer than necessary. In order for me to reopen the economy, we need testing, contact tracing, and quarantining to be effective. So what does this mean? And we have a team on quarantining. They are finding hotels so that folks who are homeless can quarantine effectively. They're people who are in congregate settings, group homes and the like, or people who are housing insecure. We need everybody to have an effective place to be quarantined. So we're marshaling those resources and getting facilities available. We need to figure out how to track people in quarantine to make sure that they actually stay in their quarantine. We're working on that. We need to figure out how to deliver essential services to people in quarantine. You can't ask somebody to stay in their house, but then not give them a hand getting groceries or medicine or essential supplies. So these are all the things that we're working on so that we can have effective quarantining. And again, I just want to give you a feel for how comprehensive the work is that is happening. Surging, I get asked all the time, are we going to have extra hospital beds? Yes, we will. We will need them. I want to say thank you to the hospitals. We're talking to them every single day. Every hospital is figuring out the surge capacity within their facilities. Over and above that, the National Guard is working with the Army Corps of Engineers. We're going to have to set up what we call field hospitals, another 2,000 beds in different locations that are not now hospitals, but that will be functioning as hospitals. So I have a huge team of people doing nothing but that. Identifying the locations, purchasing the hospital beds, purchasing all the equipment, figuring out how we're going to staff these hospital beds, changing and relaxing all the regulations and liability that go along with setting up new hospitals with 2,000 additional beds. So to those of you working hard on that, I want to say thank you. You're in great shape and you're doing a great job. I get asked every day about modeling. We are working to finalize our model. I am not putting a model out in the public until I feel that it's complete and ready and as accurate as it can be. And we're not there now. I have a team of folks working on that. We are leveraging people at Brown University. We have a team at Johns Hopkins validating it, and the folks at University of Washington validating it, and the CDC validating it. So soon, sometime next week, I'll share with you our best estimates on the model. Here's what I can tell you now. There will be a surge. It will be a steep increase. I'm going to be reporting numbers that it's not going to make anyone comfortable. Exactly when the surge happens, what the peak looks like, when the peak comes, I don't know right now. We have estimates, but we are working it, and we're going to refine it every day. But as I've said so many times, we are working for the best and planning for the worst. I also can tell you this. The single most important variable in all of these models, and I've looked at them all, is the level of compliance with social distancing. Some of you have pointed me online to the model online, the IHME model. It assumes 100% compliance with social distancing. I can tell you right now, we don't have that. So what I would suggest to the people of Rhode Island and to those of you anxious to see a model, the most important thing you can do if you want to change the shape of our curve is to obey the directions around social distancing. Stay at home. Don't congregate with people. Stay 6 feet away from people. The more we do this, the better the model will look. And then finally, we have a big team working on what I keep referring to as the new normal. So one of these days, hopefully soon, I want to be able to let you go back to work. But that won't be a flick of the switch. That will be industry by industry with new rules, regulations, and standards. And so Stephen Pryor, our Commerce Secretary, is leading a team in consultation with businesses to figure out how can we safely let you open up for business. And that will be different industry by industry. What it means for a restaurant to open safely is going to be very different than what it means for a law firm versus a hotel, versus the convention center, versus the casino, versus manufacturing. But I don't want you to think I've forgotten about that. The top of my list every day is when can we get folks back to work and how do we do it? So we're right now working through that work so when the time comes, we're ready. I want to say special thank you to the National Guard. When I began, I said that there's literally an army of people behind me. That's not an exaggeration. We have 600 members of the National Guard currently full-time deployed, probably on our way to 1,000. They're doing everything you can think of, and they're unbelievably professional and hardworking and talented and dedicated. So thank you to General Callahan and your troops who are on the ground helping us make this happen. A couple announcements. As I said earlier, everyone who's in quarantine, we need you to stay home. For you to stay home, you need a hand getting groceries. And by the way, I know how hard it is to stay home. So I'm very pleased to announce today, as of today, we have a new service called ridelivers.com. The service is RI Delivers. You can access it by going to the website ridelivers.com or just call 211. And it's a food delivery service. So if you're stuck at home because of the quarantine, we need you to stay at home, but we want you to eat, be healthy. So you can go on ridelivers.com or you can call 211, and we've made arrangements for food to be delivered to you. At this point, I want to give a big shout out and thank you to Rock's Grocery Store, local grocery store. They are our partner in this, and they're going to be doing most of the food deliveries. I should note that everything I'm doing when I'm looking to set up a new service, looking to manufacture something, looking to set up a new call center, wherever possible, I want to use local talent and local businesses. There is no silver lining to this crisis. I'm not saying there is. I just want you to know that, you know, in this case, Rock's was really hit hard. They're not as big as some of the bigger chains, and so this is a way for them to work with us to help their business a bit, and they're being terrific in stepping up to help the community, and we're trying to do things like that wherever possible. Also, there are many, many volunteers who are making this service possible, and so to you and the hundreds of other volunteers that we have, thank you for what you're doing. We could not get this done without you. A couple other notes. The burden on small businesses is just extreme. I don't know what word to use. It's heartbreaking, it's heart-wrenching, it's really tough. And I feel for you guys because you've played by the rules your whole lives. You've been frugal and hardworking. You've put everything you have into your business. And frankly, you just can't sustain being out of business for a month or two. So every day, I ask myself and I ask my team, what more can we do? What more can we do for small businesses? And so today I have something to announce. Soon, very soon, the federal government stimulus is going to kick in. Rhode Island is going to receive $1.2 billion, thanks to the hard work of our federal delegation, and much of that money will help us to help small businesses. But that's weeks away. I wish it were sooner, but it's weeks away. And I'm hearing from a lot of you, hey, I can't make it another 3 weeks. I can't make it another week. So here's what I want to tell you. If you're a small business who just can't make it, I need you to right away pick up the phone and call the SBA. Call the SBA and get that application in process. Then, once you've done that, if you can't wait for whatever time it takes them to get you the money, I have a new announcement today that we here in the state are launching a short-term bridge loan program for businesses that have 10 employees or fewer, designed to get you immediate cash to help get you that bridge to the SBA, which will get you the bridge to the federal money. I wish it were easier, but it's the best we can do right now. This program was developed in partnership between the Commerce Department and the fantastic leadership of Stephen Pryor with the local initiative support group known as LISC and the Rhode Island Hospitality Association. And thank you, Dale Venturini, for being such a great advocate on behalf of restaurants. You brought this to our attention and we're working on it. We're acting on it. We're starting out with $2 million in this fund, $1 million from Commerce and $1 million from Bank of Newport. And if there's any other bank out there who's so inclined to want to give us a hand, step up beside Bank Newport and pitch in another $1 million to this program. These small businesses can't wait. Don't let them wait, because they won't be able to recover. So it's $2 million additionally. These are meant to be small loans. I'm talking thousands of dollars, not tens of thousands of dollars, quickly available to you after you've already applied for the SBA loans that have been made available. If you didn't follow any of that, or it was confusing, remember this. Just call 521-HELP. If you're a small business, you're struggling, you need a little bit of cash right away, 521-HELP. Help is on the way. If you're a bank and you heard that, pick up the phone and call me or Stephen Pryor and tell me you'll put $1 million into this, because I have a feeling we're going to run through that $2 million very quickly. Yesterday, I want to move to a different topic. Yesterday, we received a question about visitation for parents who have joint custody over their children. And I want to clarify the guidance that we gave. If you are parenting your kids under a family court order, that order must be followed. So the family court's orders are in existence and ought to be followed, need to be followed, must be followed, even during this period of the coronavirus crisis. So I know the strain of this virus is immense, and I know that there's a good deal of tension in all of our families right now. But I need to ask parents to do your best to communicate with one another, follow the family court order. If you feel you need to modify your typical visitation schedule on account of the new rules, then just communicate with one another and come up with different arrangements that work for your family through your collaboration and patient communication in compliance with the family court order. If you can't work it out, then get in touch. Then the family court is open for emergencies, and you can get in touch with the family court, or you can get in touch with your lawyer, or you can get in touch with Rhode Island Legal Services. So the order is in place. Try to work things out between yourselves. If you can't, reach out to the family court, reach out to your lawyer, reach out to family services. The family court's open for these emergencies, and they'll get you through it, and they'll talk you through it. Finally, to end on a somewhat happier note, today the United Way has said that today is 401 Gives Day. It's a great thing. So many people are in need right now. If you're in a position, some of us are lucky through this, and you can give today to the United Way's 401 Gives. You can choose to donate to more than 375 nonprofits in Rhode Island who are making a difference to our state.